Zena Awesome. This is Vandar Awesome. We're going to talk a little bit about his surgery tomorrow. He'll be having, well, we call it minor brain surgery. Is there anything minor about brain surgery? Talk about an oxymoron. The reason we're calling it minor is it's a biopsy. Now they will actually remove a piece of his skull to go in, but they will actually be taking like a scraping from the hole that's inside his brain.
Just a little, just a little.
And so theoretically, it's not like they have to really go through the brain to get this biopsy, so it should be pretty simple. They say, yes, he has to spend at least one night in the hospital. We've got our fingers crossed that it's just going to be one night. I will be calling later today to find out what time we have to go, because, again, we're 2 hours away, so we got to leave probably really early. I'll probably let you all know in another video. And the reason we're getting the biopsy is because the cancer may or may not be growing. There's some stuff showing up on the MRI, and it could just be, I'm going to say, scar tissue type stuff, or it could be the tumor growing. And we're having a hard time talking with the doctors on coming up with how aggressive the treatment needs to be in order to do what they don't know. If he's actually got a tumor growing, then the treatment has to be more aggressive. Whereas if he doesn't have a tumor growing, then the treatment can be less aggressive. And there aren't a lot of options. So when we talk about aggressive treatment, we're actually talking about jumping outside of normal glioblastoma cancer treatments and going to more like FDA approved cancer treatments for other types of cancers that they think might work on his brain cancer. And when you start getting into that, when you take into account the side effects of chemo, you don't want to be doing a treatment if it's not needed. And also, of course, the odds of it working are a lot lower because there's no documentation showing that it's actually going to work. So that's kind of where we're sitting at. It's frustrating because I had plans. We were going to go camping and do some other things, and now with the surgery, everything's kind of been put in a holding pattern. I can't make any plans. We don't know what his next chemo is going to be. We can't, if it is cancer, that very well may be another brain surgery. They won't be able to tell us for about a week for the biopsy. I did ask the doctor if they could do a quick biopsy, because with some cancers you can send the biopsy to the lab and they freeze it and do a slide of it type thing, and they can give you results right away while the patient's still on the operating table. But according to our neurosurgeon, for this type of cancer, that type of pathology report isn't very accurate. So he says we really need to wait for the week to see what it is. Of course, if it is cancer, then we're also looking at probably another brain surgery. And if he needs another brain surgery, it's going to be one of those awake brain surgeries, because the tumor will be in his speech center, and they want to protect as much of his speech as they can. At least the doctor said, you're only awake for part of it. You're asleep while they open your skull up and all that stuff. They only wake you up when they're actually doing the stuff inside the brain, and then they put you back to sleep to close you up. So that's a good thing. So it shouldn't be
Theoretically.
Be too horrible. Because I kind of find it terrifying to think about being woke up while you know someone's inside your brain poking around.
Me too.
So, thank you for listening. Please like, subscribe, ask questions. We're going to be posting videos every day. Thank you very much.